This article, the patient's in the supine position. You are going to grasp the dorsum of the foot. I try to get my fingers as close to the ankle as possible, even onto the talus if possible, as much as possible. Again, my arms aren't extended. I'm not far away. My elbows are bent in. My feet are anterior posterior because that's going to be the direction of the force. Okay. What I can do to lock up the tissue slack is I can bring them into more dorsiflexion, take up the tissue slack. One thing that's in the description is even internally rotating the hip some, just to prevent some accessory movement at the hip while you do this. Okay, and what you're going to feel is a quick pull at your foot. All right. Take a deep breath in and let it out. As he lets it out, I take up the slack and pretty good. You get a pop in there? Felt like it. Or if not a pop, the talus comes out and then when it's just back in place.
So
Sometimes
like
you'll feel
talar curl distraction?
Yeah, it's described as rear foot, but yeah, I would say that this is mostly talar cruel that you're hitting on. You just consider it a rear foot technique. Okay?
So that would work well for dorsiflexion?
That would work well to free up either, both. It could, because you're getting that quick thrust at the talar cruel joint. Does both directions, okay? Also, just pain inhibition to the area. Person had a sprained ligament. It's not as reactive. It's not as acute now. Doing the quick thrust might help the capsular ligamentous structures to stimulate those type 1, type 2 mechanoreceptors.
Would it help with just plain hypomobility?
Yeah, it could help with plain hypomobility. Not if the hypomobility ultimately is restricted due to the joint capsule. If it's a joint capsule tightness, I'll have to do mobilizations. But if it's more of a pain inhibitory, I'm not getting motion because it just hurts a lot, or sometimes you do the thrust techniques and you free up whatever little restriction was in there, and all of a sudden it's like, oh my goodness, look at how much more motion I got. If you're seeing like, I'm only getting 5 degrees of dorsiflexion, you thrust it and now I've got 10 degrees of dorsiflexion, it's not because you stretched the capsule out, okay? It's just because you created a better normal physiologic movement about the axis that now it's getting more motion, okay? So you can see those types of changes, but it's not going to be because, oh, I did that thrust and I stretched out your capsule and now it moves so much better. Don't make that assumption that you didn't do that, but you can see the differences.
So speaking on that, it's all like, if we're talking about muscles, what you stretch is the collagen. If you're talking about joints, what you stretch is the collagen. So if your hamstrings are tight, you stretch them. You don't have somebody come and just do a quick thrust, right? I mean, that just doesn't work. What you do is